Well, I am so thrilled, and thank you so much to the Paramount for making that magic happen, that we got to see the end of the film, because we, having watched this film before, and when we screened this in Chicago, something that struck me was that sense of hope that the film leaves you with, that things are tough, and the challenges are many, but it is possible, and it will happen, where we will be able to create healthy, safe environments for our kids to grow up in and to succeed and to thrive in. And that one day, as Dr. Burke says, she'll have her grandkids on her knee and just say, oh, back in the day, they were just talking about toxic stress. And I look forward to that day. I know we all do, and believe that that will happen. And so I will go ahead and introduce our panelists, who are excited to talk with you about their thoughts on the film and to hear your questions and hopefully answer any questions that you have. So first we have Liz Cox. She's the Executive Director of Prevent Child Abuse Iowa. Liz's career includes more than 17 years working in the fields of community betterment, leading initiatives addressing health, education, and financial issues facing Iowans. Liz led the startup and management of a number of nonprofit agencies, including serving as the Director of Operations at the Iowa Healthy Estate Initiative, where she developed sustainable, system-wide health and wellness engagement platforms, moving Iowa's well-being ranking from 19th to top 10 within 3 years. Let's give Liz a round of applause. Welcome, Liz. Thank you for joining us. And we have Stacey Walker, County Supervisor and Safe, Equitable, and Thriving Communities Task Force. Stacey was born and raised one of our own in Cedar Rapids, Iowa. Stacey feels a personal commitment to make Linn County a safe, healthy, and prosperous place for all of its families. In 2010, Stacey helped launch the LBA Foundation, a Cedar Rapids nonprofit that helps middle and high school students stay on track to graduate. Currently, Stacey serves as co-chair of the Safe, Equitable, and Thriving Communities Task Force, a multi-jurisdictional coalition formed to reduce poverty and gun violence across Linn County. Let's give Stacey a round of applause. And thank you so much for joining us. And so if I'm getting this correctly, Stacey is a Wash grad, and I know Dr. Reeves is a Kennedy grad, so let's keep it nice, all right? We'll save that for after, okay? We are very honored to have Dr. Melissa Reeves here with us, President of the National Association of School Psychologists. In addition to being president of NASP, she is also a nationally certified school psychologist, a licensed professional counselor, and licensed special education teacher. She's an adjunct instructor at Winthrop University and a school psychologist at a pre-K through 12 grade school. Dr. Reeves is a co-author of Prepare Crisis Prevention and Intervention Curriculum and travels both nationally and internationally training professionals in crisis prevention and intervention, threat and suicide assessment, trauma and PTSD, and cognitive behavioral interventions. Thank you, Melissa, for joining us today. And we also are fortunate to have Anna Clymer, who is the Community Building Manager of United Way of East Central Iowa. Adopted at the age of 8 from El Salvador by her loving rural family in Benton County, Iowa, Anna has experienced many adversities alongside nurturing relationships and opportunities that have impacted her resiliency, as well as her own children and family. For the past 17 years, she has worked directly with child welfare-involved families, prevention and community engagement efforts, and equity building initiatives. This wealth of experience, combined with her position at United Way, build upon current work with ACEs, resiliency building, and trauma-informed responses with a multidisciplinary community stakeholders group. Thank you, Anna, for joining us. Welcome. We're so fortunate to have all of you here, and I am now gratefully stepping away from the mic and will give it over to Dr. Molly Marty, who will be facilitating our Q&A and panel discussion. Thank you.
Thank you, Gabby. So we promise that you will be out the door at 9 o'clock. and we took a little longer on the film. So we're going to do a couple questions for each of the panelists and then open it up to your questions. So Liz, let's start with you. We just saw some data from Washington State and some ACEs scores. What are the ACEs scores in Iowa, and what are resources we could share tonight?
So you noticed in the film that there was some data there about the people that were participating in that community conversation. They did a self-assessment, and they compared those numbers with the original ACE study by Kaiser Permanente. We've been doing that here in Iowa since 2012, and Prevent Child Abuse Iowa has written the most recent report in support with the Central Iowa ACEs 360 Coalition. When you came in, you probably saw on a table there was this report there. It is a very data-driven report, obviously, but we've worked really hard to present the information in a way that is understandable for pretty much any person of any walk of life. What the Iowa data shows that since 2012, the data that we've collected is that about 56% of Iowans have experienced one ACE. In Iowa, we measure 8 of the ACEs. You noticed in this film, they measure 10. We will be measuring 10 soon, but this report is based on 8 questions. So 56% of Iowans have had at least one adverse childhood experience. These are adults reflecting back on their own childhoods. 15% of adult Iowans have had 4 or more ACEs in their lifetime. There's nothing magical about the number 4, but we would consider that being a very toxic level of stress simply because it's 4 and it's half of 8. Knowing that number, that 15% of our adults are at a toxic stress level, we also looked at kids in Iowa, and our report is reflective of the Iowa Youth Survey. And what we know in the youth survey is that about 25% of Iowa's children are currently showing signs of living in toxic stress. We measure that by looking at their behavior. In the Iowa Youth Survey, their behavior is captured in substance abuse use, bullying, sexual promiscuity, other sort of dropout behaviors, risky behaviors. And looking at those reports of students in grades 6, 8, and 11, we assess that about 25% of Iowa's kids are living in what we consider a toxic stress environment.
Thank you. Stacey, I met you face to face right after the meeting, or after the movie, and I read your face. I know that movie impacted you in many ways. What's one thing that really stood out or surprised you, touched you?
Well, the documentary was fantastic, and I learned a lot, and it was very moving and emotional, and I'm glad, Dr. Marty, you told me afterwards that that's kind of the point. You want to get a bunch of interested parties and stakeholders in a room and really strike at the core of their being. And on that note, I'll say that all the folks in the room, and the educators, the social workers, medical professionals, and the do-gooders, and whatever role that you have, it's extraordinarily important, and I'm so thankful to all of you and grateful that you're in this community. I'm in a certain place in my life right now with my faith and belief system, but I would have to say that the work that you do is really the work of God, and I'm appreciative of you all for that. What struck me the most is how quickly the science is advancing on this topic and on this issue. But also what I'd have to say is the size of communities that have chosen to really tackle this problem, take on this issue, really means that we could do it here in Iowa. We could do it here in Cedar Rapids. We could do it here in Lynn County. If it is the case that communities in San Francisco and entire communities in Washington State can do this, they can find the resources, the will, then certainly we can do it here. One of the other things that stood out to me was how groups from across the country are working together on this issue. In my line of work in electoral politics, that's something you try to do to win an election. You try to build coalitions. And I look at some of the biggest problems here that we face, be it gun violence, be it systemic poverty, or addressing the challenge of ACEs with our youth. I think it's incumbent upon us to look to all of, again, the interested stakeholders and the interested parties and people genuinely interested in seeing this community get better and trying to identify ways in which we can come together to work together on this. And it struck me, particularly in this documentary, that not only communities much larger than us were able to do it, but this is really an effort that has struck a chord nationally, and that was really cool to see.
Great. And speaking of that national aspect, I taped a show. I do a Resiliency Matters TV show, which allows NRI 250,000 households at a time. It's a wonderful opportunity for us to get tools and strategies directly to parents and teachers and youth builders, community advocates. So Stacey has been on my show recently. It's just a matter of time before these end too are, but we filmed Melissa when she was here today. And so Melissa, we were having this discussion about what is going on a national level with schools that are trauma-informed, that get this education, that begin to do the work. What are some of your observations, having worked across the nation, with the power of this information?
What we're seeing actually in schools that are adopting more of the trauma-informed or trauma-sensitive approach is exactly what the data of the documentary showed, is they're seeing incredible gains academically and a significant decrease in social, emotional, and behavioral issues, and the teachers are much, much happier. So the teachers are actually getting a lot of training in how to understand that some of the behaviors and challenges that they're seeing in their students are actually trauma-based. And so they're being educated on how to structure their classrooms, how to structure their lessons in a way that really, speaks to the needs of these students. In addition, those schools are all integrating a lot more school-based mental health services. So when these kids are having struggles, it's not, what did you do wrong, but they're approaching it from, tell us what happened. And they actually have mental health professionals on staff for those kids to go talk to learn how to problem solve and process through this, which are all incredible life skills for them to have as they go out into the real world. So the data is incredibly powerful, and what they're also seeing is significantly higher rates of teacher retention. And I was talking to a few educators in the room. Actually, Mrs. Bean, my second grade teacher, is here, so I have to do a shout out because she was a life changer for me. But we're talking about how we are losing teachers right and left, and we, at my own university, have seen a 30% decrease in the amount of applications we have to the teacher education program because the behaviors are so significant in the classrooms, they're not able to teach. And so if we can get this approach in more and more schools across the country, and that collaboration between schools and community entities, we can make such a huge difference, not only in the lives of kids and families, but in educators too, and really retain the high quality teachers that we have. So the outcomes are incredible. It's just finding the resources and getting people to buy in to do it.
So awareness, education, all of what we're beginning here tonight. Anna, you are in the heart of our community here, working with children and adults who have been exposed to trauma. What resources are available to us locally as a community?
I think within our community, there's been that ongoing movement since having Dr. Anda in Iowa in 2010 and bringing back some of that learning back to our own community to say, this is amazing research. Why don't we know more about this? How can we integrate this into the way that we learn, the way that we collect information, the way that we change practice, the way that we change policies around how we engage with individuals that have experienced these adversities as adults and as children. And we've talked about the school system, we've talked about the community, we've talked about the state, but a lot of the work that we're looking at is how do we start at home? How do we engage parents that have been hurt to help heal them and to build those healing communities within themselves, and then further on with the next generation for their children, because that's really where the healing starts. We were lucky enough to kind of start that momentum before I certainly got to United Way, and being able to bring together stakeholders across sectors to say, have you heard about this information? What are you doing with your work that feeds into this? And I think with the resources that we have within the community, there's a capacity to connect those dots in order to really address the gaps that we have for the families and the children that we're all trying to serve, in trying to make our communities safer, in trying to ensure that our children are learning when they're in school and not stressed, and being able to really connect with local as well as statewide and national resources. When you came in, hopefully you grabbed one of the resource guides for continued learning. We helped to compile local resources as well as national, being able to connect people that are here to those learning communities, because that's what is really going to make the impact in developing those healing communities, is continuing to learn and implement strategies more individualized to parents, to youth, to school systems, to correction systems. Whatever it is that's touching our families, we want to ensure that those responses are individualized and ACEs and trauma informed.
Thank you. And United Way has compiled a extensive local community resource list. They are looking for additional resources that continue to build that out, but that's available through them. We'll give a link as well, because we want to make sure that you have those resources at your fingertips. So great work. So Liz, with your in-depth experience here with adverse childhood experiences, what needs our immediate attention going forward? All right, there's people in the audience, they watch this film, we need to do something. It's not okay what's going on. What are next steps?
So there's 4 that I wrote down, but there's probably a list of 20. But I'll just stick to 4 for right now, because these are achievable things. And I think it's important that we think about quick wins and what's achievable right away that can have a lasting impact. So the first thing we can do is create a common language. And that's what this film is trying to do. And anybody that has an opportunity to take an ACEs training, or even a Connections Matter training, which is an ACEs-informed program, you should. Creating a common language is essentially important to this work. And we know with effective change management, we all have to have a common vision and at least understanding of the change that we want to see. And 75% of us need to know what that change is and why it's important. So creating that common language is a perfect first step. Secondly, we can change policy. Policy change has lasting impact, and our legislature just this session created policy that reduces ACEs. They unanimously voted legislation that protects kids who are exposed to drugs. First time in Iowa for opioid-exposed kids and kids exposed to cocaine and heroin. That's really important. There's more work to be done. Sexual abuse prevention is critically important. One of the things that wasn't mentioned in this film was the connection in that initial Kaiser study. The predominant report of ACEs in the initial study was actually sexual abuse, and that being directly correlated with obesity issues. So when we look at sexual abuse prevention in a policy framework, that impacts education. And so passing something like Aaron's Law, which is sexual abuse prevention services for our teachers and also for our kiddos. You heard it in the film when they, I forget the storybook gal, but thank you. You know, nobody's allowed to touch me in my private parts. Kids need to know that. And preventing sexual abuse is a huge priority in reducing ACEs in our state. The third thing we can do is fund. You know, they talked in the film about home visiting and using nurses in home visiting to work with young moms, help support young moms in their own parenting skills. That funding right now is up for renewal at the federal level. I'm going to throw an acronym out there. It's called McV. Grassley is a huge supporter of McV, and this is critical, essential funding to provide that one-on-one support for young parents, not just moms, young parents, to create a positive and thriving home environment. And the fourth thing is connect, and that's something every single one of us can do. You saw in the film, it's data-driven, that meaningful, caring connections really do matter, and each one of us can improve our own connections. I recently made a presentation to some 5th grade students who were doing a special project on child abuse prevention, and their presentation is tomorrow night, and I can't wait to go see it. They asked me, what can we do to prevent child abuse? And I told them, the solution is so simple, it's going to really blow your mind. And they were really challenged by that. What do you mean? I said, what the solution is? It's friendship. That when you and I are connected, I'm less likely as a parent to be stressed out. I'm less likely to use drugs. I'm less likely to, self-medicate in a lot of different ways. And when you and I are connected and I need help, I know that you're there to help me. And I'm there to help you. And the same is true for kids. And so I asked the kids, what would happen if there were more friendships at school? They were just like, there'd be less fights. We'd have more time for schoolwork. We'd have more fun at school. They had a whole list. They knew right away what it meant to have more friendships. And then I said, what if your teachers had more friendships? Oh, they wouldn't have so many hard days at school, and the teacher sitting next to me nodding her head. We know this solution. It's meaningful, caring connections. It sounds very simple, but it's very challenging. It means purposefully reaching out to someone, caring. And not just your own kid, that kid. That kid that is the challenging kid, that's the one that needs the most love. And that's the one that you got to reach out to, because that's the one that also needs it. So those 4 things.
Beautiful. So, Mr. Policymaker, sitting next to Liz, what seed might we plant together tonight? I know those wheels are moving, but what are you thinking as far as next steps with policy or local systems?
So I think I agree that there is a lot that can be done at the policy level and local government and state, at the statewide level and certainly at the federal level on these issues. But extending beyond policy and thinking about what the community could do, particularly considering my background is in community organizing. That's kind of the movement I came out of. At the fundamental level, I think folks have to be willing to engage with one another, be willing to trust one another, to sit in a room and try to tackle big problems. I guess at the policy level, we need to challenge policymakers to be courageous, to make sure their budgets line up to the things they claim to be priorities. Budgets, as Joe Biden famously said, it's a statement of your priorities. Don't tell me how much you care about something. Show me where it's reflected in your budget. I think people, the movers and shakers in the community, have to be willing to stake their own political capital on some of these tough issues. I have a lot of conversations with people in private, and they tell me, how much they care about these issues. But I don't always see that reflected in their comments in public, and that's troubling to me. And there's probably a reason behind that. It's much easier to talk about, it's much easier to show up when we're cutting ribbons and the community is excited about, opening of a business, or the community is excited because we've planted some more trees, and all that stuff is good. But I'd like to see people, particularly in positions of power and authority, excited about having the opportunity to solve some really tough problems in the community. The 2 other notes I took on this was sort of dovetailing off of what Liz said, is we've got to be willing to support parents and families. We have to be willing to support programs that are going to do that, that are going to offer wraparound services. Here locally, we've got the Total Child Initiative, and we've got a model that the United Way is experimenting with right now, the Spark 5 initiative. And community organizations, community leaders need to be willing to double down on these offerings. Last thing I'll say is this. I've said this before to a few groups, but it's really, really important because there's a big lesson here. When asked about his genius, Albert Einstein said he didn't consider himself to be a genius. He said that he thinks that he just stays with problems longer than most other people. And, I tend to believe that the more complex a problem is, sometimes you got to be willing to invest more time and energy in solving it. One of the toughest jobs I had recently was getting policymakers and decision makers to think differently about gun violence and how you address it. And I, was using the metaphor, you got to get underneath the problem, which is to say you got to think about its systemic roots. And systemic change is hard and it takes time. And we as a community need to be willing to invest that time that it takes to change these tough issues.
Great. And there is an excellent resource that we had mentioned. Stacey is co-chair of the Safe, Equitable, and Thriving Community Task Force. We sought resources from everyone, and that just came in a little past printing time today. But we are also going to have a link to that on our website. It's a very, very helpful look at, you take an issue you think is simple, gun violence, and you realize very quickly that it is multidimensional and it needs a lot of partners, community partners, to meet that complexity and to move forward. So we will be sharing that out. So Melissa, we're here as an educational event, and I want to make sure nobody leaves tonight, the adults, educators, parents in this room, if they are not yet familiar about a movie that in our world, the psychologists we're dealing with, and I mentioned earlier, we started our work in suicide and a social contagion, and there is a film out right now that is literally taking lives of our children across the country. And I want Melissa to be speaking to educate you and to provide a framework of how we can, it's out there, so how we can be using this as an opportunity to be supporting our kids and keeping them safe. So.
Because I can vaguely see in the audience, how many of you out there have heard of the Netflix series called 13 Reasons Why? Okay, most. So, yeah, obviously this has gone viral. It is incredibly controversial, and I guess one of the positives you have to look at is that it has definitely started some really difficult conversations. There's definitely a lot of concern around this. I know even my own daughter, who's a freshman in high school, we were walking the dog a couple weeks ago, and she's like, "Mom, have you heard of that series called 13 Reasons Why?" And I'm like, "No." And she proceeded to tell me what it was about and the graphic nature of it, because it does deal, with bullying and, acquaintance rape, and a very graphic scene in the very last show of a suicide, where it shows everything about the suicide, which is not at all what you're supposed to do because of contagion. And I said, "How many of these 13 episodes have you seen?" And she goes, "All of them." And I go, "Whoa, whoa, whoa." And I said, "Why didn't you tell me you were watching this?" And she says, "Because I know what you do, Mom, and you tell me no." Yeah, and so I thought, okay, I could yell at her for this right now, or I could really use this as a learning opportunity. Well, within 24 hours, at the National Association of School Psychologists, emails and phone calls were coming in like crazy from parents and professionals saying, "Oh my gosh, there's so many kids that are getting a hold of this." And no, you don't have to have a Netflix account. You can get the episodes off YouTube. And if you tell your child no, guess what? They have a friend who has one of these and they're going to see it anyway. But there's definitely, we have some very significant concerns about this particular series. Number one, the graphic nature of it. For our students, I keep saying students because I'm so used to working in schools, but children who already are vulnerable and have risk factors. Many of us in this world feel like that it glorifies suicide, and it sends the message that it is a potential solution to a problem for which we know it's not. In addition, because of the 13 tapes that she leaves behind implicating peers that either outwardly were part of the bullying or didn't do enough to really stand up to help stop it, it really gives that character who decides to die by suicide a lot of power over those that have been left behind. So clearly that is a message that we are really concerned about, and we are now starting to get calls saying that there were suicides or attempted suicides and this show was referenced. In addition, just the graphic nature of the show, many of the students and children out there, I think, are going to have a hard time processing it, especially if they're already vulnerable, because there are multiple trauma triggers within this series. So pay particular attention to those kids that are vulnerable, because we just don't know what the outcomes are going to be. Now, I always try to find the positive in everything. I will say the positive note is it is leading to a lot of discussions for which no doubt adults need to help facilitate the discussion. I've watched the series. It was hard for me to watch, and I've dealt with some pretty difficult things in my career. I have real concerns about middle and high school kids that are getting access to it, being able to really process and understand all of this without adults being there to do that for them. One of the positive messages, though, that is coming out of this, and thank goodness my kids got this message, is that you have to be an upstander. And there's no doubt that this kind of bullying goes on in schools, in communities, but there's significant consequences if you don't stand up for what's right and you are not part of the solution and helping to stop it. So if there's any positive message out of this film, it is that. And I hope that a lot of the, that the individuals that are watching this are walking away with that message, and we start to see more activism around anti-bullying and really being an upstander. But there's definitely concern because the very last episode ends with the suicide, and there's not any resources provided after that, and there's a huge cliffhanger, which also could potentially implicate homicidal behaviors. And so, I'm speaking to the choir for some of you that have already seen it, but all I can say is no, it should not be mandatory viewing in school curriculums. Absolutely not. There's too many trauma triggers in here. But if the students are seeing it, use it as an opportunity for dialogue, education, and discussion. And I hope we can really rally students to stop the bullying behaviors that are going on and to get help when you or a friend need it, because there is help out there. Suicide is never a solution. There is always help available.
Thank you. And NASP has recently issued some talking points on the film. Judd Foundation, I know we put that out on our social media today. NRI is coming out with a blog looking at the social contagion aspects of it. So again, there are resources. So if this comes up and you want to be prepared ahead of time, that's ideal. But if you need those resources, they are available online.
For those of you that do work in the schools, there are actually many schools that are taking the initiative to reach out to their parent population, and they are posting web links to the talking point resources for parents. So the Judd Foundation has some good ones, the National Association of School Psychologists have some. So if you haven't done that direct outreach to parents, it's viral. It is everywhere. I guarantee the kids and the students know about it, particularly in middle and high schools. Don't hesitate to reach out to the parents and provide guidance for them and links to those resources.
Thank you. So Anna, in your community work, what can you share with us about how we each can play to our strengths? We each have these unique contributions to make. How are you seeing that come together across our community?
I see that in the work that is kind of unfolding when we do provide that support to cross-sector collaboration, kind of innovative building of tools that people can have. One of our clinics that we support here in our community has started screening their patients for ACEs and other basic needs, not just, what's your score, but really figuring out what might this person be dealing with in addition to why they're coming to the clinic today. We have a substance abuse treatment program in town that is also assessing for not just ACEs, but also where are their connections, where are their supports, what kind of resources are they aware of as far as how to stay clean, how to gain appropriate housing, and in addition to supporting your children and dealing with whatever they've dealt with, as well as yourself as an individual. Kind of as we talked about earlier, it's really about being that one person. Be that person for somebody else, for your own child, for your own self sometimes. That self-assessment that we encourage of individuals to start looking at this is not kind of as it was referenced in the film, is this has to be treated as a societal issue, a scientific discovery that really gets at the root of what makes us ill as a society, as a community, as a family, as an individual, and really start utilizing what we can learn and that shared language that we talked about in treating each other with universal precautions, right? We assume that people have been harmed or have had some trauma occur to them. How are we compassionate in a way that really helps them not just seek the help they need, but receive the help they need in the way that they need it? So being able to be that one person, that one source for us to continue to share the learning that we have within our own sectors, whether it's education, our school districts locally are learning so much about how do we address student needs differently. When a student is sent out of the classroom, they're losing that time of being educated. So how do we wrap around them and ask them what's happened, what's going on, and how do we then provide those supports for those families? There's a lot of partnerships going on with the University of Iowa that's assessing how do educators learn about ACEs, and then how do they start implementing trauma-informed responses that fit the needs of their building, of their population, of their community, and being able to really gain some of that knowledge from those that are doing the work. And certainly as a United Way, we welcome anybody that wants to be part of that conversation. As Stacey referenced earlier, some of our evolution of our work in regards to health, financial stability, and education has really come to that tipping point with our Strong Parents and Ready Kids, if by the age of 5, the Spark 5 project, that it's more than just one thing that helps families be successful. It's many things, and it has to include community, and it has to begin with parents.
Thank you. So we have 2 microphones, one set up on each side. And at this time, I have more questions. I can keep going, but we want to turn it over to you in a community conversation. Perhaps you want to share something that you took away from the film, or you have a question for one of our panelists.
My son came into my life 4 years ago. He is almost 8. He has an ACEs score of 10. I am involved in a committee that is reviewing the use of seclusion rooms in another school district close by. And I've noticed that there is a lot of people who do not believe that adverse childhood experiences or trauma can cause children to present behaviors that disrupt classrooms. So they really believe that children are choosing to behave like this to get negative attention. How would you explain to professionals that ACEs is very real and that the behaviors are a symptom of a problem that's going on?
We know. And here's how we know. So Prevent Child Abuse Iowa has been working in partnership with the AEA. If you're familiar with the structure of how we support educators in Iowa, we have this agency that provides all the technical assistance and training to all of our teachers and administrators. And they're a huge partner in that work. We have been introducing them to this language and this concept. And it's been a very exciting process. And we have been faced with similar challenges of the philosophy of behavior and really people having a belief that kids have a choice in how they behave. And what we've been trying to do is just really talk about the science and the research. And when you get the Harvard Institute involved, you saw the researcher here, those are the folks that are involved in our project Connections Matter, which talks about the resilience and the importance of having caring connections. But we also talk about ACEs and what they are, and the data behind the number of ACEs and your brain development and your learning outcomes. And it's been a sprinkling approach because we found that smaller doses of data help build momentum. In terms of changing someone's core belief in systems of thinking, that's really challenging. So we know that there are people, educators, really smart people that really do believe in the philosophy that you're speaking of, and we have a ton of respect for them. We just disagree.
And I will say, at the individual level, find someone in that school or in that district that is open to hearing this message. I have to put my plug in here for school psychologists, because one of the frustrating things that we face in our profession is we are still, and Iowa is one of them, where our school psychologists still primarily used for testing for special education eligibility. And we have very clear data, Boston Public Schools is one of them, that when school psychologists are used more on the front end in regards to prevention and intervention and providing mental health services, the behaviors improve, the academic scores improve. So if you can find that gem within that building or within that district, or one or two people, also find the school psychologist. Most of us would love to get ourselves out of the dang testing role, or at least do less of that. That are willing to hear your message. And there's actually a great YouTube video. If you just Google Trauma-Informed School San Diego Principal, it's about a 6 to 7 minute YouTube video that is a principal talking about how he embraced the trauma-informed approach in his school and the difference it's made, and they interview parents and teachers and kids in regards to behavior. So it's starting with those small conversations. As I say, work around the resistive people, find the few that are willing to listen to the message, and then slowly with small doses, you can start to make change and infiltrate some of that thinking. But definitely seek out the school psychologist, the school counselor, if your district has social workers, because we get this stuff. But a lot of times we as an individual don't have a voice, but if there's someone willing to pair up with us to help be more of a collective voice, that gets the ball rolling, and that can make a big difference. And it's a marathon, it's not a sprint, as I always tell people. Systems change is not easy, but it does start with a few individuals.
Very good. Stacey or Anna, would you like to weigh in on that?
I was just going to say it starts with you also. I mean, with you being such an advocate and seeing the big picture and being able to utilize your voice and connect with those resources that are necessary in order to get not just, issues resolved for your child, but also for other children that have also experienced trauma, which, as we saw, it's very common. So being able to continue to be a champion for your child is going to be vital, and utilize resources. There's so many. We even have somebody here in our audience from the school district, so being able to voice what that needs to look like for parents and youth is going to be also key.
Thank you.
And I know I'm not officially a panelist, but I would simply add that component is self-care. That's so essential, that trauma-informed care includes that care for the practitioner as much as for the patient, for the teacher as much as the student. And so it's really important that as you're out there championing, and I feel that, and I felt this virtual hug from Liz to you, and she's like, I know. But that self-care piece is essential if you're going to be continue to champion for your own child, for other children in the community. So take good care of yourself.
In this current environment, financially, how would we be best to move forward, I guess is what I'm asking. So it's a really easy question.
I will answer that from my perspective, being a policymaker, being in government, and I will do my best to be diplomatic about how I answer this question. The short answer is we got to get scrappy. Folks in the movement now have to be very enterprising and even more innovative than we've ever been before because of these financial constraints. I will also say, the earlier point I made about budget documents being a reflection of one's true beliefs or priorities. And so if we can extrapolate the true beliefs and priorities of the individuals who were elected to make our statewide budget, then I'll leave that up to you to determine, to come to a conclusion at what their true beliefs and priorities are. So elections have consequences, and I think folks around the country are realizing that, particularly folks in this kind of work that you're engaged in. And so with that, we now have an opportunity, an even greater obligation within the next 2 years to not only educate elected officials who control the purse strings, but we have to educate the general public because this information needs to be in their minds the next time they go to the voting booth.
And I can speak from a school's perspective. Yeah, we're in a serious budgetary crisis in addition to a human resource crisis within school districts because there's a shortage of, educators everywhere. But we are just going to have to get more creative at the limited use of funds we have. And as we say, we're not going to get more. We have to learn how to strategically place those dollars. And for example, when I mentioned Boston Public Schools, they didn't get any more school psychologists. They didn't get any more staffing. They really took a look at how should they be more efficiently and effectively utilizing the expertise that they have. And it really was more from a prevention and an intervention framework. And this is coming from a school psychologist. What good does it do me to do a full psychoeducational assessment on a child and write this very lengthy report that I'm not sure anyone really reads? How is that changing anything for the child? And a lot of times it doesn't because we're not changing the service delivery for the child. So let's put our resources into changing the service delivery instead of doing these things that don't necessarily, make a big change. I think the other things that I see schools do quite often is they don't do a needs assessment first on what exactly do we need to be investing our dollars in. And I'll speak to staff development. I see them do staff development trainings all the time, which are like these one-shot trainings. So the teachers or the educators, the mental health professionals attend them and then they leave. But there's nothing systemically in place to embrace that new knowledge to actually be able to implement it. So I see lots of professional development dollars wasted when you either don't have the administrative support to make the change or you're not putting the things in place from a systemic perspective to be able to actually embrace and integrate that knowledge, or I say going from theory to practice. So I think there's things that we can do to better use our resources, but it does entail really looking at the systems change that's needed to support a lot of this work when we know we're not going to be getting more dollars.
Hi. So thank you from the bottom of my heart. Very personal reasons for that, for everything that you guys are doing. But I have a question as a mom. Is there a way that this training can get to social workers, DHS, and the foster adoptive parents, the PS math that's going on? Because we have adopted 3 little ones, and we are kind of learning in the war of what's going on in our home. And as we find out more and more of this stuff recently, it's making sense. But our parenting was coming from what we knew and not what the world that they live in that we can't even wrap our minds around, honestly. So is there a way that this training can get put into that training for these parents and for these people that are working with these kids that are just coming out of such trauma?
Yeah. So you might know that Prevent Child Abuse Iowa works in partnership with the Department of Human Services, who coordinates a lot of the services that you're talking about. And part of our work is sector work and trying to implement trauma-informed prevention and care coordination and services. We're doing that systemically right now with the Department of Education and trying to really bring this common language and framework together, and we're doing that through AEA. We're also working with the Department of Public Health, similar method. Our next step is to work with the Department of Human Services, and this might be a change that you might not know about. So the foster and adoptive care support providers that currently provide that support to the community on behalf of DHS, that leadership is going to change beginning July 1st, and it will move to 4 Oaks, and I believe it is Lutheran Services of Iowa. So it'll be 2 different people providing that sort of training and support for foster parents starting July 1st. I can tell you that Four Oaks is one of the most trauma-informed providers in our state, and you're so fortunate to have them right here in your community. So I would expect that there would be some significant changes in the foster and adoptive care training and support moving forward. But more systemically, we would expect in the next 2 to 4 years that all the contracts that come out of DHS, all the contracts that come out of Department of Public Health, have written in them trauma-informed practices so that this becomes a systems way of thinking and doing business. And I think we're getting to that tipping point when we already have Department of Public Health including ACEs in their 5-year strategic plan. ACEs is now written in their 5-year strategic plan. It's the first time that's been done in Iowa. So we have one department committing to that, and we know that Department of Public Health, their job is prevention. So just imagine if they do it right and they do it really, really well, the stress that takes off of Department of Education, because we have kids that don't have as much trauma. We have kids with better learning outcomes. And imagine the stress it takes off of DHS, because we have fewer kids in the foster care system, fewer kids being neglected and abused. So I'm really excited to see this work building itself into systems and policies within our departments. I think it's challenging to include this in corrections, but I see it happening, eventually. Because everybody, I think we all know and understand that people that are incarcerated had a pretty traumatic childhood. I would keep asking that question within your own network, because just like through education, we had a lot of teachers asking for this information, which made it easier for us to knock on the door of AEA and Department of Ed, because people were coming to us. We were doing trainings in schools all over the state, and I just kind of said, listen, we can't go into every single school by ourselves. We need your help. And they said, oh, okay, we'll help you. And that's kind of the need that we have within the Human Services Department as well, that we need consumers to start asking for it. So it's a little easier for us to come in and say, yeah, we've got that help. We can help you.
And I want to repeat, and I know you don't want to be running everywhere, but Jamie as well, if there is a group, this is part of why we brought in Prevent Child Abuse Iowa, we've worked with Prevent Child Abuse America, and Liz actually had her hand heavily in contributing to that facilitator's guide. We really did try to bring you the most experienced experts that we have access to that could come here. But upon request, you can get a group of foster and adoptive parents and the network, and you make a request, and Prevent Child Abuse America will come and show this film for free and facilitate a discussion. And you also know where to find me, and I will be happy to help any way we can. All right. Thanks. Did you say one more question? Okay, sorry. All right, and let's wrap up with one more question. Thank you for waiting.
Thank you. So I'm a behavior-focused teacher in the area, so I see this right in front of me every day, 8 hours a day. What are your recommendations for kind of tackling this in my classroom? Specifically, the video talked about if we talk about these things, get it out there, maybe it's not so scary. Maybe if people, students and adults alike, understand that others go through this, they may feel a little better or just be a little bit more at ease with it. So I don't know if you guys have any recommendations for how to breach this with my students, if I do it all, or just a way to do that so I don't add another traumatic event by talking about it.
Melissa, do you want to start with that?
Yeah, there's a couple actually really good resources online. So if you have a few moments to stick around afterwards, let me get your contact information. I can send them to you because it's about how you can approach this within your classroom. I think part of it is opening the discussion with these kids, acknowledging the adversity and the challenges that they've had. I mean, it's kind of like putting the elephant in the room. But boy, when you open that door and they know that it's safe to be able to talk to their teacher and that their teacher acknowledges and validates that things have not always been easy. Number one, I think that's a huge first step with kids. I think the other thing too is when they do things that might be considered bad, or they're not following rules, or they're being a little bit more difficult, one of the big hallmarks of the trauma-informed approach is asking them what happened instead of jumping into the punitive measure, and being able to take a little bit of time, whether that's you, or you could pull in the psych, the social worker, the counselor, or someone else, just to spend a few minutes with them saying, tell me what just happened. And by them being able to actually share their side of the story, it opens that door to be able to then problem solve with them. And we're still sending the message that, you know, what you did is not okay, but what can we learn from this versus jumping into the real punitive measures. And when I train administrators, I tell them all the time, punishment alone does not change behavior. We have to spend the time actually teaching them the skills that they have. In addition, we know trauma impacts memory, it impacts attention span. We know that there's trauma triggers. You know, some of these kids can hear a noise that we may not notice, but for them it may be a sign that, you know, it's like the heavy boots on the ground when, you know, the person who's hurt them is coming down the hallway. That impacts their learning. So also ways for which you structure the classroom, for which information is given in, you know, smaller snippets, very interactive, very hands-on, very collaborative, and providing them breaks and actually having them, teaching them the skills to ask for when they need a break. And I kind of reference this for those of us that are parents, when we need a mommy or a daddy timeout, that's okay to ask our kids for that. And I think too, to give them the language instead of them getting an adult enforced break because they did something wrong, it's being able to use the language to say, I'm overwhelmed right now, can I take a few minutes? And setting that kind of culture within the classroom can definitely help. So giving them the language tools to properly express how they're feeling and ask for help or ask for a little break is super powerful.
And I think we'll go a step farther and we'll ask you to write a guest blog on NRI, sharing those resources out to everyone. Not next week, I know you have a full schedule, but that will happen as well. And thank you for bringing that, because all my bonus questions were focused, the bonus questions I had were focused on those specifics. Okay, how can I go back to my home tonight, or to the classroom tomorrow, or to the workplace, or to my work in the community? What will I do different tomorrow, having invested my time and energy here tonight? And so I love that you did the work for us and brought that back. I think that's the perfect ending place. So thank you again, Liz, Stacey, Melissa, Anna, you've been fabulous. Thank you for you to attend. And on behalf of NRI, we're just very, like I said, very appreciative that we're able to share our work and some resources with our local community. And our annual conference, the next one, if you want to mark your calendar, October 16th through the 18th. Melissa's actually our MC, but we bring some tremendous resources together, like this film and other experts in the area. So you can, we'll be in touch now that you've signed up and you can follow along, but we'd love to continue this conversation on how we can better support you. So thank you, have a safe trip home, and we really appreciate your time.